Hey everyone, I want to go over low back rehab phase 1, and we'll be taking you through this instructional video, and I hope this helps you at home. So I have Allie here with me, and she works here at the office, and I'm going to have her as a patient. I'm going to have you lay on your back and face up. So if you've been in my office and I give you the low back rehab phase 1, this is a way for me to show you how this is done without having you do it in the office. Have you bend your knees for me? So if you are at home, find a surface that you can lay your back on. Typically not a bed, that's just way too soft. So find either the floor, you can always grab like a yoga mat, but you want some kind of support for your back. So unless you have a table like this at home, try to find the floor if you can. So if your knees are too painful to get down on the floor, you can use your bed, it's just not the best place for it. Okay, so let's go through this. And if you have this sheet at home, I'm just going to go through it line by line. One of the exercises on here called the TA activation is actually not on this sheet anymore. And so I'll be showing Allie how to do it, and that's kind of the basis of what most of these exercises are built on. So I'm going to go over that first, but you will not find this first one on this sheet. Okay, so going over the TA activation, which stands for the transverse abdominis activation, and when we do this and contract it, you're actually getting down to really root core. So the multifidi, which is our low back muscles, and then the TA is part of our abdominal muscles, and we're going to be engaging the diaphragm that's going to contract it. And when we contract it, you're going to feel the stomach and low back actually expand, so it'll go up, go down, and you'll feel that tightness. That is actually true core work. So let's work on this. I'm going to have you taking a deep breath, and most people will want to try to suck their stomachs in. We're not going to be sucking our stomach in, we're going to be pushing our breath down towards your feet, which doesn't make a whole lot of sense at all. So I'm going to have you, first of all, cough. There you go. That's the pressure that we want. So when you take in a breath, you'll be pushing again down this way, not sucking your stomach in. So go ahead and do that. And when you do it, the stomach should raise. Yep, keep bearing down. There you go. And when you do this exercise, actually put your hands by your sides. So you want to find about the pant line, about go a little bit below that. That's where you're really going to feel this engage. Go ahead and relax for me. And let's try that again. Try to relax, relax, relax. Okay, breath in. And then push down towards, there it is, that's the TA, the transverse abdominis activation right there. And when you do that, again, the entire core expands, and keeping that core as strong as possible. And then you want to hold this for 1 minute. So that's the challenging part. You can breathe at the same time as you hold this. So the goal is for 1 minute with this one, and try not to relax this. So go ahead and do it again, and push it down. And then that in and of itself, it's a 1 minute exercise. So what you're, go ahead and relax. So what you're going to see on the instructional, I guess the exercises that I've given you for your home, it'll say in a lot of different categories plus TA. So whenever you see that plus TA is actually this exercise, you have to contract this when you're doing or performing another exercise. So whether that's bridging that we're going to go over here in a little bit, you'll be doing the bridge plus that TA activation, which is getting that core intact. Okay, so I have the instructions right here, and the first one that you guys have at home, it'll be not posterior, it's actually posterior pelvic tilts. And so what you're going to be doing with that, I'll be putting my hand underneath your low back. Go relax for me. And so what you want to do, now when we do these exercises like this one, putting the posterior pelvic tilts, forget about the TA activation, so we're not pushing down this way at all. This one you actually are going to be tilting your pelvis down this way. So you'll be putting pressure on my hand, yep, keeping the legs down though, keeping the glutes down. And you'll hold that for 4 seconds, and then relax. So that's 1, and then back down. And it might be difficult to see on the video, but she is putting pressure on my hand. Let me get that from the side and then relax. And you have 2 sets of 15 reps on this. Actually, all the exercises except for that, for the bridge and the TA, those will be 1 minute, but these will be, the sets and reps are always 2 sets at 15. Good job. Okay, next one is the bridge. Keep the arms here. You're going to, bring your pelvis up off, the table. Now, this is where that TA comes in. So this is hard enough by itself. But when you're in this position, the next step that you want to take is to engage that TA. So go ahead and do that. Yep, pushing down, and hopefully you can see that on the video. She's engaging that core. Again, she's pushing up this way. and then go ahead and relax. So sometimes when we just do that bridge, it can create pain by doing that, but if you can engage the core, that TA activation at the same time, it will keep the entire core stabilized and you should not have pain with it. So if you do have pain with it, just work on that TA activation without bridging, just on the table like this. Once you have that down without pain, then go ahead and try to raise and then engage that TA. The last one are Supermans. I'm going to have you lay then face down for me. And with the Superman, it's just exactly like what it says. Or Superwoman, to be correct here. And on the actual exercise sheet, it shows the person with the arms straight out. Allie, I'm going to have you keep the arms actually bent like a goalpost.
Right here?
It takes some of the pressure off the shoulders. There we go. And so with this exercise, again, it's 2 sets of 15. And what you want to do, Allie, is you're going to be raising your arms and legs at the same time. And go ahead and do that. So keep the arms bent, though, when you come up. I'm going to have you just keep them bent. So
okay.
You come up, and then back down. So there is no hold. So you're going to be coming up, and then back down, And then you'll be going through 15 reps of these. And if you really want to, the last one that you do, you can hold it for 5 or 10 seconds. Go ahead and hold. And then go ahead and relax. I won't make you do it. But this engages your low back. This is a great low back exercise. With this exercise, when you're experiencing low back pain, if this is creating pain, we actually want to work away from pain for most cases. And so if this is aggravating or bothering your low back, just don't do this one. Work on that TA, work on the posterior pelvic tilts, work on the bridge. Just skip this one. Okay, let's go over the last 2 stretches that are also part of the Rehab low back phase 1 exercises. And these are the 2 stretches, most common stretches that I give out. Most of our hamstrings, at least with you guys coming in as patients, just the hamstrings are so tight. So we want to work on loosening up the hamstrings and then doing a good kind of SI low back stretch. So the first one, which is a hamstring, I've already put Allie in this position. So with one leg back, this is a hurdler stretch, is what they call it. The goal with this one is, Allie, I'm going to have you reach for as far as you can, but don't let the knee come up at all. So you can certainly reach farther if that knee comes up, but you want to keep the knee down. You'll get more of that hamstring stretch. And then go ahead and switch sides. You would hold that for a good 15, 20 seconds. And it's different with everybody because you have to feel that stretch. So if you're not quite feeling that stretch. Now, most of us aren't going to look like this. She is more flexible than the rest of us. And so just if you can't quite reach your toes, that's completely fine. Just reach as far as you can. Just don't let that knee come up. Then go ahead and lay on your back and your head can go here. This next one is for the SI joints, for the low back. Okay, what you're going to do then, the arms are going to go out. And this is a better stretch actually on the ground than it is on a table like this. Actually, a bed would be a great place to do this. And then what you're going to do is you're going to bend this knee. We'll go this knee over here. And then use your right arm to grab your elbow, and you're going to pull that across. There you go. And then you're going to get this nice stretch kind of come through here with the SI joints and with the low back. And then, of course, then you would, same thing, 15 to 20 seconds. Just kind of feel that release. And then go ahead and switch sides with it, other leg. And then use, there you go. And then bend it across. And again, a lot of us won't look like that, but get as much stretch as you can. So all of our flexibilities will be different and vary, but that will give a good low back stretch.